My name is Neville Solomon and I'm the head of Department of Pediatric Cardiac Surgery at Apollo Children's Hospital, Chennai. I do complex adult congenital cardiac cases too. So we need to embrace technology to help the pediatric cardiac surgeon do very complex surgery safely with very low mortalities. Scylla VR is part of this. They've been kind enough to collaborate with us and we're working with them and been giving them input how to develop the program further. So as you know, this is a very vital part of our technology. First with redos, we started collaborating with them, so using the three-dimensional reconstruction, and the team has been very friendly and collaborating with our team and getting us educated, and most surgeons are not IT savvy, so they've been helping us get acclimatized to understanding the various aspects of the technology that's applicable to our profession. So in redos, we're able to understand the structures immediately behind the sternum so that we can effect a safe re-entry. And we also understand that the various, and there is no fixed rule in complex congenital cardiac surgery. The vessels, the SVC, IVC, the aorta, the pulmonary veins, the chambers of the heart, right atrium, right ventricle, left atrium, left ventricle, nothing is where it's normally supposed to be. Everything can be twisted or turned upside down. And so we need to have a preoperative orientation of not only what's behind the sternum, but where to search for these structures, particularly in a redo scenario where there are a lot of adhesions. And the next thing we're looking at and developing with Scylla VR is, and they are developing the software and constantly upgrading it, complex ventricular routings inside the heart. So when you have a complex double outlet right ventricle in association with something like a AV canal, then it's very easy to do a Glenn or a Fontan. But then this is condemning a child to heart failure in 20-30 years from now. So as pediatric cardiac surgeons doing high-end surgery, we have to concentrate on doing complex surgery safely. So we should embrace the challenge and do complex biventricular routing. For that, we need the help of technology, wherein the surgeon for instance, if the aorta is arising entirely from the right ventricle and there's pulmonary stenosis, we need to know whether we're going to do the Glenn Fontan, or are we going to do a root translocation, are we going to do an arterial switch and a VSD closure, or are we going to do a very complex intracardiac tunneling by which we direct blood from the left ventricle under the... So effectively, in a few words, it means planning out the surgery before you enter the chest. And then we can take the technology up a notch by tailoring patches. Formally, if you close with one patch, there'll be stenosis, so we can develop 2-3 patches and figure out a configuration by which we can safely create a pathway within the heart without collateral damage to neighboring structures and a non-obstructive pathway. So this is where we are embracing modern technology now in partnership with Scylla VR, so that we can plan effective surgeries for very complex congenital cardiac surgeons and do high-end surgeries like recruiting the ventricles and making it a proper biventricular repair, so that children can lead a normal life like you and me, rather than be confined to a single ventricle pathway, which may be a temporary quick solution, but with questionable long-term results. So thank you so much.
So good morning everyone, I am Dr. Swaminathan. I am working as a pediatric cardiac surgeon in Apollo Children's Hospital. Regarding the Scylla technology, that is the virtual reality integrated with the CT scanning. Unlike the conventional CT scan where you can see only the two-dimensionally the structures, this Scylla helps us to go literally inside the heart, and you can make sections inside the heart and see everything very clearly. So this is truly a revolutionary technology. But if we can show the Scylla to them, they can also will be able to understand the anatomy. So what is really happening inside the heart. I wholeheartedly congratulate the team behind this Scylla, which includes the Hari, the main man who discovered this, and then Narasimhan, Hemalata, Raghav, Ifra, everyone, they have done a tremendous job. So this will be a path-breaking technology in the future. Those kind of advantage you will be having if you use this technology, then go to the theatre. So this will be a truly revolutionary technology in the future. So as I was explaining the advantage of the virtual reality, so you can see here I am sitting in front of the monitor wearing this glasses, and I will be able to slice the entire heart in front. This is, for example, this is the heart of the patient who is going to undergo the surgery. So you can see the entire structures here, the right ventricle, right atrium, there were a great vessel, your aorta coming from the left ventricle, your SVC, your IVC, branches of the aorta, innominate artery, common carotid, subclaving your pulmonary artery. So for example, I am just slicing the anterior wall of the right ventricle. I am going and seeing the tricuspid valve inside. I am going further inside, going to the LVOT and seeing the aorta pathway from the LV to aorta. So I am slicing in the right atrium and going seeing the SVC now. So everything is seen very clearly, and even the patients can be asked to sit here, and they can wear their loops and they can see their own hearts with the help of this. So this will boost the confidence for them also. As a team, this is a very good technology in evolution. Thank you.